Hello, good afternoon and welcome to the first Eucerin live chat session. I'm sorry for the delay. I'm Dr. Vincent here from New Life Lifestyle Aesthetic Clinic in Bangsa South. I'm very happy to be here today to share with you about the causes of sensitive skin. Primarily, we'll be looking into a little bit of atopic eczema, and whereby later on we proceed into our topic topper where we see how the urban lifestyle, skin living in the city, how the urban lifestyle can affect the skin condition. Today, the flow will be as such. We'll start the chat by understanding a bit about atopic eczema, followed by its causes, and then lastly, solutions for the problems. This will roughly take about 15 minutes. And after that, I'll be showing you an interesting video prepared by Eucerin. And lastly, we'll be open for some questions and answers. You're also reminded that you will need to register your Gmail account before you can post any comments during the Q&A sessions. I will answer your queries as best as I can during the Q&A questions. I'll take as many questions as possible if the time permits. And also, there's good news here, whereby Eucerin has promised to give away one piece of Eucerin soothing cream worth 65 ringgit for every participant who manages a comment during this live chat session. So do not miss out this opportunity. Feel free to drop me a question anytime during this 1 hour session and get yourself the free Eucerin product. Okay, without wasting any more time, I'll go into a bit about atopic eczema. I'll give some introduction about atopic eczema and what it is and its diagnostic criteria. Atopic eczema is actually a very common skin condition. It is an itchy inflammatory skin condition that has genetically linked, meaning some of it is genetically inherited, and for some patients it is exacerbated, that means made worse or brought about by some environmental triggers. Over the years, there have been many diagnostic criteria that have been applied to try and help a doctor make the diagnosis of atopic eczema. I'll quote one from the Cardiff University of Wales, which includes atopic eczema must have an itchy skin condition, which may or may not involve the flexures like the elbows, behind the knees, in front of the ankles, around the neck. It may be related to conditions like asthma or hay fever. It has a visible flexural rash, meaning rashes at the flexures, means like your elbow area, your neck area, and such. And it has the onset early in life, roughly about 2 years or so. And in general, all atopic eczema patients has dry skin, right? So in clinical features of the atopic eczema, it's actually very, in skin conditions, most of the conditions appear the same. So it is up to the doctor that we have to know which is which. We go by these certain clinical features to help us recognize eczema. One is called erythema. Erythema is just basically redness of the skin condition that is poorly demarcated, means it doesn't have a very obvious border. In eczema patients, you will have scratch marks. In medically, we call it excoriation. Sometimes you may see some form of puffiness on the skin, swelling, like which medically we call it edema. Sometimes you see some form of oozing or even crustings on the skin. And in very long-term cases, which means chronic cases, the skin will thicken to give something called lichenification. And of course, the most interesting feature of all in eczema is if one is to feel the patient's skin, atopic eczema patient's skin, it will definitely be dry and it feels a bit rough. Okay. And what about the natural history of atopic eczema? About 90% of young children who have moderate diseases are actually managed in primary care in Malaysia. About 60-70 of these patients actually can go into resolution by the time they reach adolescence. This is more so for the patient group that is not affected by environmental triggers, in the patient group that are affected by environmental triggers, they actually sometimes face what we call a lifelong struggle to get the illness under control. And to them, avoidance of the trigger factors become very, very important. And here I would like to stress out that atopic eczema, not only it's a skin condition, it is actually very, very important psychologically for a patient. In a lot of universities, they actually score the eczemas to see how bad it is, and in this course, they actually included the psychological stress factors of eczema, what it does to a patient. So what are the certain psychological factors that to be considered in patients with atopic eczema? One is they get sleep disturbance because of the itch at night. Sometimes they can suffer from low self-esteem because of the appearance of the skin condition. Some younger kids tend to display traits of dependency and clinginess. And of course, they may impact their life in terms of sports, because sometimes sweat makes it worse, sometimes swimming makes it worse. It may also disrupt certain time commitments for their own family and parents due to commitment to bring the children for treatment and things like that. So we must not underestimate the psychological impact of atopic eczema as well. Without further ado, we'll try and go more deep into today's main topic, whereby skin in the city, how urban lifestyle can trigger atopic eczema. Urban lifestyle is actually very desirable for a lot of us because of the opportunities that it presents living in the city. However, for patients with atopic eczema, it brings about certain challenges for them, as they are more exposed to environmental allergens. What are the environmental allergens that are common in around us that can actually trigger eczema? One is food, actually. There are the most common one being seafood, sometimes the eggs and chickens, but it's not said that everybody with eczema displays the same hypersensitivity to these foods. There are certain tests that can be carried out by medical doctors to pinpoint exactly which are the food that triggers the eczema. Other than that, house dust mites is another common condition. Certain animal furs like cats, dogs in the house may act as triggers. Pollens from trees and flowers are also another triggers. Living in the environment, you're exposed, in the city center, you're exposed to a lot of air pollution, and also air pollution can trigger inflammation and itchiness that makes eczema worse. So there are mostly, again, I recap that eczema, there are two arms to it. Mainly one is a genetically inherited one, and one is very, very closely related to the environment triggers. So if we can manage both correctly, patient will have a good quality of life. And also I'd like to stress here again that every patient, regardless of whether it's genetically inherited eczema or whether they are prone to environment triggers or not, they will have dry skin in atopic eczema. Moving on, we'll discuss a little bit about management of atopic eczema. I will not go too detailed into the too detailed medically into the treatments available for atopic eczema, but roughly every patient of atopic eczema will need some form of emollient, some form of moisturizer that doesn't irritate their skin but protects their skin instead. Other form of treatment ranges from different strengths of topical steroids to topical immunomodulators. There may be some kind of bandage therapies for very severe cases, light therapy, and also oral immunosuppressive for very, very severe cases of eczema. We will talk a little bit about emollient, as I think this is something very general that everybody with atopic eczema should have access to and should be holding in their hand, because in terms of other kind of treatment, it is best to be prescribed by a medical doctor and also be monitored by a medical doctor because of certain side effects of treatment. Like example, if your patient is on topical corticosteroids long term and if there is any abuse of these steroids, maybe of high potency steroids, it can actually cause a lot of skin side effects like skin thinning and also forming of veins and things like that. So it is best for anything more than emollients to get a medical doctor consultation and a doctor to monitor. But in terms of emollients, there are a lot in the market nowadays. It is very important for the consumer themselves to have a look and see which is which, what emollient is suitable. So emollient should be applied regularly even during remission period. That means remission is like even during when eczema is not itchy or is not red, to keep the skin hydrated, and it should be prescribed in generous amount. Anyway, that's what the practice is like in UK and Cardiff as well. Application usually should be immediately after bath. It can be applied 2 times a day, and if you are using it with some form of topical treatment, it should be applied at least 30 minutes before the topical treatment's application. If you are wondering for a good or let's say a clinically studied kind of emollient, they have Eucerin has actually come up with one soothing cream like this, right? In it contains omega-6 fatty acids, ceramides, and which actually help improve the skin barrier. It also has what they call lycocalcone A, which is actually anti-inflammation, which actually acts on it blocks actually one of the pathway to prevent exacerbation of asthma. So again, this is the cream that is available, and to prevent further dryness of the skin, it's also actually very recommended to use soap-free products. Just to remember that, because certain soap products, they actually wash away the protective lipid layer of the skin. Again, if you're looking for any, I think there are a few in the market. I think one of them available will be this, the pH 5 soap-free solution. But again, it's up to the patient's preference, or you can even seek a medical doctor's advice before looking at the products. Some of the products available nowadays comes in the form of bath oil as well, so it's up to personal preference also. Now, after discussing this atopic eczema and how urban lifestyle can trigger the atopic eczema, I would like to show you a video that is about a couple of minutes long. It's pre-prepared by Eucerin. I think it's a very interesting video. I hope you all enjoy it.
So, the source of light is setting commonly jungle with leaves and bed, and additionally, it's cool. It rays from sun, limited particles in the city, and additionally, for moisture from the because we're really suffering from dry anxiety, where there's an itchiness or most patients go through a chance with disturbed skin barrier. As a result, skin becomes dry and itchy. Different skin dryness that causes redness and itchiness, regular scratching, skin flushing, barrier function. The disease cycle keeps repeating itself never stops. Infections continue to express. Now, let's look into the cause of disturbed skin barrier dryness. Most people lie lotions on their skin to moisturize the skin barrier. The normal region only provides surface hydration and can only compare acidity. Surface hydration is only temporary. It can evaporate and skin is dry again. Skin redness and itchiness caused by severe skin dryness. When skin is too dry and skin is activated flame, lines of liquid, skin is red and feel itchy. Regular scratching will other barrier function. The cycle continues. Introducing expensive cream. It contains glucose and grease, which is omega-6 fatty acids, strengthen skin barrier, hence keeping skin barrier repairs, moisturizes, and looks severe skin dryness deeply. The channel is encouraged and the switch natural factor to produce skin's redness and itchiness. local redness and itchiness, therefore reducing the allergy to scratch. Dipping cycle is resolved. As a result, skin is not only hydrated, it's also repaired to age-specific symptoms and occurrence of redness and itchiness. Now here's the sun, city, and air conditioning in. And now, it's your turn to use.
So just to recap, again, atopic skin eczema is a very common skin condition that affects a lot of Malaysian population. Whether it's triggered by environmental factors or not, most of the patients, and every one of the patients will have dry skin and also impaired skin barrier. And one of the most important treatment modality that we have for atopic eczema is a good emollient, followed by other topical corticosteroids. So I'll open the floor for questions. I'll take some questions and see how many I can attend to with the time that is available. So what are the questions that they have for me? Well, while waiting for the questions, again, I'd like to stress to patients with eczema that emollient is very, very important. If you're not too sure which to look out for, you can try the one that they've just showed you on, the Eucerin soothing cream, which is omega-6 and also lycocalcone A, which improves the skin barrier and also reduce inflammation of atopic eczema. Okay, I have a question here on I have a very big inflammatory acne. Okay, primarily we're discussing about eczema, but I can take that question as well. If you have a very big inflammatory acne, most likely you'll be categorized under severe acne patient. This need medical treatment, and I would assume that you will need urgent medical treatment because a huge acne tends to leave behind a scar, and if a physical scar is left behind, it is permanent. So I would advise yourself to get a medical consultation before proceeding any further. And of course, a big no-no is is expressing the acne out or seeing a beautician for those sort of procedures, right? I'll take the next question. So okay, they've asked. So maybe I'll answer one of the common questions asked by my patient while waiting for some questions to come in as well. Just give me a minute. I have a collection of questions here. So what are the reasons? A lot of people ask the reasons for poor response to a treatment. One being poor compliance. Compliance means the patient doesn't follow the doctor's instructions or doesn't apply the medication as per prescribed by the doctors. Compliance actually is a big problem in Malaysia, not only in terms of skin conditions like atopic eczema, but also in high blood pressure and diabetes. This is actually have to do with the patient's own motivation to control the illness. Without proper compliance, whatever medication that is given or whatever good emollient that is used will not yield proper outcome of treatment. Another common cause on why there is poor response to therapy is some patients, they buy a lot of topical corticosteroids over the counter, and unfortunately some salesperson, they do not know the potency of certain corticosteroids, and they prescribe different strengths of corticosteroids for different stage or different grades of atopic eczema, which will result in non-resolution of the medical condition. And also another common cause of poor response to treatment is the eczema has actually developed some form of secondary infection. It may be bacterial or it may be viral infection. And the last most common condition that I can think of is superimposed contact allergy, meaning the person is continuously being exposed to the trigger factors that causes the eczema to become worse. So again, like living in the city, you'll be reminded that it gives us many opportunities. It's a stressful environment for atopic eczema patients because we are always exposed to air pollution. There are a lot of dust mites. Also, living in the city actually creates psychological stress, work stress and such, which has been clinically looked at to have caused exacerbation of the atopic eczema. Right? I'll go to the next question that has been posted. I'll read from the sheet. I have itchy skin. What should I do to calm the itch? Okay. When the skin is itchy in the first place, it means that it is being irritated. It can be irritated by the skin can be irritated by a lot of conditions. It can be something that you have used topically. That means you have applied on the skin that has caused irritation. It can be some form of infection, maybe fungal infection, or it can be a proper eczema condition, or sometimes a skin itch condition can be a hypersensitivity reaction as well to certain things that you eat. So most of the time, a proper diagnosis is needed before a proper solution can be given to the patient on how to calm this itch. But in general, if you are looking for anything at all immediately to calm your skin, go for a very good moisturizer that is non-irritant to the skin and also has protective factors for the skin, and then try and get yourself a medical consultation. Right? I hope I answered your question. And the next question, what is the benefit of using Eucerin? Can Eucerin cure atopic eczema? So that's the question. Okay, the benefit of using Eucerin one will be it is a medically tested or clinically tested product, in the sense that it delivers whatever it promises. Because there are a lot of I would say a lot of over-the-counter products that has not undergone medical studies. So they can promise the world, but some do not deliver. So it is important that primarily any product that you choose, whether be Eucerin or not Eucerin, go for a medically tested product. And in terms of Eucerin products, it is a very good synergistic topical agent. Synergistic means it works very well together with the existing regime for atopic eczema because of the contents of Eucerin products. Some of them that I have in hand, like the Eucerin cream, will have omega-6 fatty acid that actually helps improve the skin barrier. This is the cream again, right? That helps improve the skin barrier. And also it has lycocalcone A that has anti-inflammation. A few other products in Eucerin will also contain the medical content of it is the methoxypropanediol, which is an anti-itching factor, and also decanodiol, which also has antibacterial protection. If used correctly synergistically with proper topical agent, it can help the eczema condition. And it also can be used. I can stress out here that we cannot use topical steroid long term to manage eczema, as it can cause skin complication. Whereas certain emollients can be used long term, because the skin will forever be dry in an eczema patient, because genetically their skin lacks certain factor. So a good emollient will always be needed to keep the skin healthy. By keeping the skin moist, healthy, is actually a big step towards controlling and so-called curing eczema, right? Okay. The next question, right? My brother has eczema when he was a little child, but it's fully recovered already. Now he is 21 years old. is there any possibilities he will get eczema? Oh, sorry. It's okay. Thanks. So we'll take the next question again. The next question, it sounds like this. I used to develop contact dermatitis on my thumb when using dishwasher of certain brands. Last month, I developed dermatitis on my plantar. Plantar means I think it's the foot, the bottom of the foot, while having exams. Can stress trigger atopic eczema? Okay, the first part of your question is while using dishwasher, you've developed eczema on your thumb. Yes, that is also very common. Dishwashers, hair wash, strong detergents, soaps are all very strong irritants to the skin. To reduce the irritation on the skin, try to protect your skin with proper moisturizer while using them. It can actually reduce certain exacerbation, but overall, it's not advised for you to be using these detergents to prevent exacerbation. And then, yes, it has been shown that stress can trigger atopic eczema. So the advice is try not to get too stressful, even though it's exam, right? Okay. Next will be, my daughter is 4 years. She has eczema. It comes and goes. She will scratch it when she feels itchy. How can I stop her from scratching? Her skin are very dry and rough. Now both her cheeks are starting to get dry. Okay, first of all, in these questions, she's mentioned a lot of time that the skin is very dry. And yes, primarily the eczema before the exacerbation or before even the rash comes out, the patient's skin will be dry. So again, topical emollient means a good moisturizer that is non-irritant needs to be applied on this child. That is the first step. And then to control the rash, then you need the added medications that work synergistically with the emollient. And being a child, it's very important not to abuse topical corticosteroids or any other form of topical immunomodulators. And also, I've realized that you've mentioned that your child scratches a lot. It is also not really recommended for child to be taking a lot of antihistamines, but over short courses, yes, it's possible. But there is a condition, if you heard me say, there is a procedure, if you heard me say earlier on, whereby we call bandaging. If the eczema is severe enough, sometimes we put on some certain kind of wet bandages at night to prevent patient from physically scratching, because by bandaging it, it actually provides a barrier so that the patient cannot actually scratch it. And scratching actually worsens the whole cycle of eczema, because as you scratch, the skin releases certain chemical factors, just to put it that way, that will make the skin even more itchy and the eczema even worse. So just to recap, your child probably will need a very good emollient. Get a doctor to prescribe proper medical treatment, and then she may need something to prevent her from physically scratching the eczema. Right? The next question, I think I have sensitive skin, because it's hard to find products that is suitable for my skin, and my skin tends to get dry, itchy, flaky using unsuitable products. Products with whitening and active, we'll take the first part first. I'll make a comment on the first part first. Again, I think I have sensitive skin because it's hard to find products that are suitable for my skin, and my skin tends to get dry, itchy, and flaky. Okay, atopic eczema is only one of the conditions that can cause skin dryness. There are other skin conditions that can cause skin dryness. This is just to highlight to you in the first place. Products with whitening and anti-acne, stroke anti-blemish, mostly not suitable for me. If you have already dry skin, try not to go for over-the-counter whitening agent or anti-blemish agents, because most of the time we know the medical contents of this product, and one of the side effects of this content is actually makes the skin even drier, and it actually exacerbates the redness, makes the redness even worse. So if you have dry skin, try not to use it at all. Right? The next one will be, I have old scars from blemish, medium-sized pores, and uneven skin tone. My skin also seems to be seasonal, sometimes feel normal and sometimes feel dry in some areas. Can you please comment? So I think from what I see here, I think you have been using a lot of whitening products that has actually, too long of whitening products that has been actually now manifesting itself as side effects on the skin. So first of all, I would advise you to stop whatever you think you are using, correctly or not correctly. Stop it first. Bring the product to a medical doctor, let him analyze it, then from there decide on what to do next. Because I say wrong products sometimes can cause skin to have further problems, right? Can people with eczema take warm showers? Yes, it's not a problem, but for some patients it actually triggers certain itch. Besides emollient, what oral supplements can help to cure atopic eczema? Okay, primarily eczema is a skin condition. So if we were to deliver any kind of, let's say, supplement, I would advise you to supplement the skin directly with proper emollient, means proper moisturizer. Oral supplements have not been really clinically studied for eczema. There are a lot in the market. If you were to go for any, try and get one that has strong medical research backup. So if you were to give any supplement, I would advise you to supplement your skin direct by applying a good moisturizer on it. And the next question will be, looking for the next question. If you come down a bit. Okay, that's Chinese. Yeah, and so the Chinese one, if you want to. Right, anything else that people would like to ask? Is there any way to prevent eczema? Eczema is, actually there is also a lot of many kinds of eczema. What I'm discussing here today is primarily atopic eczema. Atopic eczema is a genetically inherited condition, and some of them are actually triggered by environmental factors. So in terms of atopic eczema itself, how to prevent it from becoming worse is one, prevention of exposure to the triggering factors. And in atopic eczema, again, strictly to atopic eczema, the skin is always very dry because it lacks certain lipid layers and it lacks certain factor, and the skin barrier is actually very poor. So by preventing exacerbation, I've mentioned again, an emollient is actually very, very important, even before the doctor even before a doctor actually come into the picture. So a good skin emollient is actually a very good prevention. How to reduce the effect of air pollution to our skin? Well, air pollution in Malaysia, I think in recent months, when there is haze and all, it's even worse. Again, we can't do much about the air pollution itself, but we can actually help protect our skin. I will always say that the skin is always at its most healthiest when it has full of water, because water actually improves the skin barrier. And how do you deliver water into the skin? You deliver water into the skin by a proper moisturizer or a proper skin emollient. So by taking care of your skin moisture content, the water content in your skin will naturally be stronger than it is to protect yourself from the air pollution. And like I said, unfortunately, we can't do anything much about air pollution unless move away from the city, right? Hi, Dr. Vincent. My elbow always itches. As I scratch, it will spread. Is this eczema sign? Yes, possible it is a sign of eczema. Remember, in any form of skin condition that is itchy, scratching actually makes it worse, because scratching releases chemical mediators in the skin that actually makes you want to scratch it more, makes it more itchy. So as you scratch, what we call a vicious cycle, you scratch, you release this chemical, you become more itchy, you scratch even more, you release even more chemical. So in a way, prevention of scratching is very, very important. And yes, possibly you have eczema, but again, it's not only eczema that causes skin itch or skin rash. Better get it reviewed by a medical doctor, because wrong medication can actually worsen the conditions. It is also very common, I would like to point out here, that patients with certain fungal infections, when they walk and buy some over-the-counter topical steroid, it can actually changes the shape, or what we call the morphology of the clinical appearance, the appearance of the rash. So by the time they get to the doctor cannot really recognize its classic appearance anymore. So it actually delays treatment and makes it worse. So again, please, before jumping into the conclusion that it's eczema, seek some medical advice. If you really want to put anything on it at the moment, topical emollient again will be your first choice. The next question will be, can food intake help control atopic eczema or reduce the effect of atopic eczema? If yes, any food can help. Thanks. How food intake can affect atopic eczema? I think there have been studies, there are some papers that looks into how nutrients, some anti-inflammatory factors in certain food can actually help reduce inflammation of not only skin conditions like eczema, but also inflammations of other skin conditions. Omega-3 has been shown to reduce certain kind of inflammation, but a lot more studies need to be done in terms of eczema-wise. But in terms of food, I would really highlight to you yourself that avoid triggering factors, avoid food that triggers your eczema. There is tests that we can do for each individual to see if he is or is not allergic to that food. This is easily available now if the doctor has access to the test, and they will give you a very nice report over 42 types of food or so, and then from there you can pick it out and see what are you allergic and what are you not allergic to. So that would be my best advice, avoiding triggering food allergens at the moment, and not delve too much into food as a holistic approach or to manage eczema. Okay, I have a reply from the patient that I've answered earlier. She said, thanks for the reply. We have actually brought our daughter to a skin specialist and get medications, but it seems not helping much. And we have even tried using lots of different lotions to prevent dryness, but none help. And my daughter's skin will sometimes show cracks on her body and will have blood. Okay, okay. Early on, I did not mention another sign or symptom of the eczema is what we call cracks in the skin. It's actually medically called a fissure. If the skin is too excessively dry, yes, it will crack, and it's actually very painful to the patient. From what you tell me, again, your daughters have very dry skin. And in terms of being parents, yes, I know parents are very worried. They want to have a fast solution to the illness for the child. But sometimes I will also advise the patient that doctors or any medical treatment cannot do magic. We need time, so we need patient to be compliant and be patient. Typically, if you tell me that the skin condition is on such uh, dryness level with cracks, I will tell the patient the treatment will need at least 4 to 6 months. And topical emollient moisturizer becomes very important factor to it. And being compliant to one is also a very important factor, because switching products sometimes can be counterproductive. I'm not saying that you've been doing something wrong. I know that you're eager also to get the condition control as well. But sometimes we need to advise the parents to be patient as well. And of course, not only emollient. For your daughter, you definitely need a soap-free bath, a bath that is not that does not cause irritation to the skin, does not wash away further natural lipid layers. Like I've shown earlier, here, like all this is one of those that will be extra gentle that you can actually try, and it needs to be used over long term. Probably we're looking at about 4 to 6 months to get the skin condition up to somewhere near acceptable, and then from then on we take it for another year and see what happens. Okay, and also try and get sorted out fast, because if the skin has cracked and all, the protective barrier of the skin is actually not that strong, so it can cause the child to have secondary infection. Okay, the next question. Hi, I have eczema when I was a child, and it has dramatically improved over the years while I'm overseas, being in cold and dry climate. Recently, I moved back to Malaysia, and my skin has started showing signs of itchiness. Does climate change trigger eczema? Can it be fully recovered? Thanks. Okay, yes, climate change can trigger eczema. And again, like I say, different countries have different level of pollutions, and also different level of triggering antigens to skin eczema, like pollens and such. So if you are exposed to, if you come to a condition, maybe whether it's in Malaysia or in somewhere else, that has these triggering factors that will cause you to aggravate your eczema will resurface. Is there permanent cure for eczema? Actually, the real answer is there is no permanent cure to eczema. We hope to get it controlled and keep it controlled. And like I say, the natural history earlier on, about 70% actually once it go away, it doesn't come back. We are yet to fully understand why, but like I say, once you get to that stage when it's controlled, try not to do things that will aggravate it. Right? I hope that answers your questions. Okay. The next question will be, my friend has infection with eczema and uses petroleum jelly. Petroleum jelly is actually a very good occlusive moisturizer, but sometimes it can irritate the skin. So a lot of people actually don't really like it because of the oiliness of it. Sometimes it can cause certain skin infection like folliculitis as it clogs up the hair follicle. So usually I don't use it, and I do not know any of my medical friend doctors that actually uses it. Okay, due to large surface area affected all over the body, he could not afford to buy expensive body cream. So he has put in bracket a few brands. Although he know well the goodness of these dermatological products, how he should do to help his eczema condition apart from applying emollient and bath once only per day. Okay, the most simple thing I can think of will be starting from the bath. A lot of time, yes, we have been educated to times when we shower, we use soap. Try to avoid soap. If you really need to avoid soap, usually I'll tell patients use soap on the areas that are covered, certain the armpits and the genitalia areas. And if you really cannot afford anything, you can just shower with plain water and minus the soap. and then gently dab your skin. Do not scrub it while you dry it. Applying emollient, yes, emollient. I also understand that a lot of emollients in the markets are quite can be quite pricey, but there are some very basic ones that are available. But of course, again, you need the doctor to try and advise you on which, because emollient will definitely help your condition. If let's say cost is a factor, I'm sure we medical doctors can help you come up with certain emollients that is favorable to yourself. Yes, some emollients are better than others. That is also true. But in general, it is better to have some form of emollient in your skin than none at all, right? Uh, he know well how to avoid trigger factors, which is good. And the question mentioned like changing his bed sheet regularly. Again, that's one thing that people has done. Of course, if let's say cost is not factors, there are also certain things that we can buy off certain mattress shops that gives the protective cover over the mattress. Avoid food triggers and uses non-fragrant body care. Well, if you have non-fragrance body care, I would think in this case, reduce the cost that you've incurred with the non-fragrance body care to substitute it with a form of emollient. I think that will be more important for yourself, right? Okay. Do we have a lot of time left?
Answer 3 more.
I'll take 3 more questions, right? This is again another patient has asked me another question, and another question is my right hand near my finger part, right, is itchy. What causes this, and how can Eucerin help? Again, itchy skin condition can be due to a lot of things, but usually around the fingers it has got to be do with certain kind of contact eczema, contact dermatitis, right? Avoid the triggering factors again. Yes, Eucerin can help, as in the sense that it's an emollient. Usually what I get my patients to do with contact eczema is apply a lot of lotion in the body, over the hands, especially like hairdressers and so forth, before they start their work. If you remember, having water in the skin is actually having a shield of protection over your skin. So your skin will react more favorable to allergens. But of course, the best case scenario is avoid the triggering factors. Okay, the next question is, how frequent should I apply the Eucerin soothing cream? Does it help if I put a humidifier in the room? Yes, humidifier sometimes can help, but also again, you have to see the brand of the humidifier, whether it works or not. In general, Eucerin cream can be applied twice a day. So there's any other emollient, and if your skin is very dry, you can even use more times, because a good moisturizer doesn't irritate the skin, doesn't cause problem to the skin, but it provides the water needed for the skin. And I will take the last question before we wrap up here. Right, the last question is, my facial skin is mostly oily, but it gets itchy and red quite often. Would that be eczema or some other condition like rosacea? Thank you. And this Smith. Rosacea is not common among Asians. To start off with, it's common more in the Caucasian age group. We will really need to look at the clinical appearance of the skin before I can tell you whether it's rosacea or not. But in general, if your skin is oily, it tends not to be eczema. But it gets itchy and quite red. Yes, possible that you have to look at the products that you're using. If certain products are causing certain hypersensitivity to the skin, it can cause this kind of redness. And yes, rosacea is one of the conditions, but I cannot pinpoint for you here that it is rosacea. I hope that helps answer your question to a certain extent. Right. So I think this will be the end of the live chat session for today. I apologize if you have posted questions and I have not taken due to the time constraint. I hope I have managed to answer most of the questions clearly. And then for those who have posted a question just now, please PM Eucerin Malaysia on Facebook to claim your free product. I do not know what that means, but I hope you do. Thank you for your participation and hope to see you again in the next session. I'll be again here on the 16th of August, same time and same place. Hope to see you then. Yeah, thank you. Bye.